In sub-Saharan Africa, nearly 23 million people have HIV. Every year, there are 1 million new cancer patients. Many organizations are working to deliver medicines to these people. But one of the greatest unmet needs is for palliative care. Now, ENDO is working with organizations that are delivering palliative care efficiently, effectively, and quickly.
One of our FASHA board members, Dr. David Lee, also has been involved with ENDO Pharmaceuticals for several years. And it was really David who introduced ENDO and FASHA and helped them to understand the work that we were doing.
I was at a meeting in Windhoek in Namibia, and I met with Dr. Faith Mwangi Powell, the Executive Director of the African Palliative Care Association. And she said to me, look, you're involved with the pharmaceutical industry. We need a better association, a better partnership with the pharmaceutical industry.
And David said, what can I do? And I just said, David, you work with the pharmaceutical industry, don't you? We don't need you to create new drugs. You have created an effective pain-managing drug. Unfortunately, this drug is not being used. It's not accessible. Can't these people who have manufactured this drug support it to be distributed, to be accessible? What's the point of having this drug if people are dying in pain?
I see palliative care as a very simple definition. The World Health Organization has one definition of it, but I just see it simply as pain management. And that can mean anything from a simple aspirin to helping a headache, all the way to the administration of morphine to ease pain with cancer, and including spiritual care and grief needs and counseling needs for not just the patient, but the entire unit of care.
And, you know, I can tell you countless stories of patients that I've seen in end stages of life with terminal cancer, with terminal AIDS, who are in acute pain and have really nothing more than the equivalent of Tylenol for that pain.
Simple medications like aspirin, things that we take for granted here in this country, are huge necessities out there to be able to find.
And most of the hospitals and most of the health systems in the African countries just don't have the experience. So this project is so critically important in terms of even just sensitizing the whole hospital system to what palliative care means and what pain assessment and management is about, and then giving very practical training to doctors and nurses and pharmacists on how do you deliver it.
The problems are huge. But I always ask people to narrow themselves into particular group of people, into particular person, into particular organization. And that way you can make a difference without really worrying about there's so many issues going on. Because in Africa, there are also very, very innovative people trying to make a difference. And it's finding those people and partnering with them.
When we began to really understand the enormous need for better pain management in Africa, what really occurred to us was that this was perhaps a unique opportunity for the pharmaceutical industry.
We bring the doctors in place, but that's not enough. We bring the policymakers, the governments. We tell them, let's sit and talk together. It's a project where the dollars go to the patient. There are no overheads and big processes and bureaucracy.
When David came to me with his passion and direction in terms of Africa and its needs in pain management, for me it fit exactly with the type of scope and culture that I want to see this company develop. Because yes, we're in pain management from a commercial setting, but our first role is to manage pain wherever, however.
I will not soon forget the words from Dave Holvac, our Chief Executive Officer, who told me, if there are patients in pain, there are patients, and it doesn't matter where they are. And so we've got a project that is aligned with our expertise, our technical expertise in pain, and our medical expertise, our lobbying expertise, We've got a project that is aligned with our passion for helping people who are suffering from pain. And we have all of the elements of a classically well-run corporate social responsibility program that's making a difference in people's lives. When you realize how great the need is, and when you realize the great impact that we can have, it was easy for me as a lobbyist to do what I do, which is convince people that they too needed to be a part of the program. So we went out to other trade associations in Washington, we went out to other healthcare companies, we went to some of our partnering organizations in Washington, and we told them this story.
So we persuaded Pharma to allow Faith to present at the annual meeting of Pharma. And she presented to a whole group of pharmaceutical industry CEOs, told a very impassioned story. And from that, and again with ENDO's leadership as the lead sponsor, we were able to raise several tens, if not hundreds of thousands of dollars to support the project.
It was again very humbling in that meeting, because I sat in this meeting with all these manufacturers and all this, and everybody's talking about this molecule and that molecule, and I'm thinking, well, I don't really have a molecule to talk about, but I have a drug which you have created, but it's not accessible. Can you help us to make it accessible?
ENDO helped bring together many pharma companies to donate money, time, expertise, and resources to the effort.
So we began the project back in February of 2011 with just 3 countries initially, with Kenya, Malawi and the Gambia. And the project has been so successful that we've now added on 3 additional countries in Swaziland, Zambia and Rwanda. We anticipate training several hundred healthcare workers in those countries.
And we see a day in the not-too-distant future where all of sub-Saharan Africa has appropriate pain care management systems in place so that patients can be cared for.
For its assistance to FASHA, ENDO was presented with the 2011 Spirit of Compassion Award, recognizing ENDO's dedication and generosity to this project, thanking Dave Holvac, David Lee, and Julie McHugh for their leadership and contribution.
The 2 individuals who have been most helpful have been Brian Monroe and Brent Fisk. And I will tell you, these 2 gentlemen have been so amazing to work with. They have very busy day jobs, and yet despite all of that, they are working very hard on behalf of FASHA and our partners to raise money for this very, very important project.
As for any thanks that is coming our way tonight, we are viewing it as all in the rearview mirror. For this is more work to be done, and more progress to make in the fight against pain in Africa.
Another organization ENDO is working with is AMREF, the African Medical and Research Foundation. Founded in 1957, it has become the largest health organization on the continent. Its innovative idea was using light planes to quickly get medical care to villages and the bush, and to transport patients to hospitals when necessary.
We got the thing going a little more and a little more. You know, we had no concept that it was going to turn into this major organization that it is today, with many, many areas of interest and work. So when you fly into some little rural hospital and you take care of, you'd be a long line of patients waiting for you. Then you suddenly look around and you realize that, you know, it wasn't just a cleft lip you were operating on. You know, it was a kid with a cleft lip and worms and malaria and undernourished and all of these other health issues. The most important thing, probably single thing we've done, is training basic village health workers. And of course we go from that end of the spectrum on up to highly, technical surgeons. I know we've done over 200,000 surgeries over the years.
Working with third-party advocacy organizations or third-party organizations is what I was brought on to do. And with ENDO, we have as the company grows, so does our focus on these new strategic partnerships with third-party organizations. ENDO is completely committed to working with these organizations aligned to where we have expertise to help the patient and bring better solutions and outcomes to them, whether that's in our local, national, or even global community. ENDO is different because we don't just put it in writing or put it on our website that we are going to be involved with the community or involved in social responsibility. We are taking action. We are pursuing this unified, socially responsible strategy across all our companies on the local, national, and global level.
I think the elements of what makes up ENDO is not its products, it's its people. And the people and the legacy of its people, such as a David Lee, current employees, a Brian Monroe, connective players of our industry, such as the Pharma Organization, or others that have been brought in under this project. I think all of this is just an extension of what we want to be as a company, which is a company that sees its rewards through helping people.
Well, ENDO has really stepped up and taken the lead as the lead sponsor in this project. And as the lead sponsor, it's been able to attract other pharmaceutical companies to join. And what we see as we go forward, I know again with the enormous support and enthusiasm of the senior management team, is to be able to continue to develop this project.
And when I think about them, I feel really privileged to be partnering with such wonderful people. I think that is what I've enjoyed most, partnering with both fascia and working with ENDO Pharmaceuticals.
So what we have found is that by actually seriously addressing pain in an individual patient, you can improve their quality of life. You enhance their ability to then look after their families, go out to work, and by doing that, you're then impacting the entire family and, as again, the knock-on effect, the entire community.
I think when every day I go out and I see that we are changing the lives of people in very simple but very deep and meaningful way, I get very fulfilled with what I'm doing.
Fascia, APCA, and AMREF have an effective model. They don't set up infrastructure. They work with the existing governments, hospitals, professionals, and leaders in every country and get the care out to the people quickly.
I don't know of a single doctor that's worked for us or any other overseas organization that hasn't said what a rich and rewarding experience it was for them.
The right to die without severe pain is a human right. Yet so few people in Africa are able to achieve that basic human right.
The goal of this program is to end the sound of suffering in sub-Saharan Africa.
And that's the reward that I think we all live with long after the financial results get tabulated and recorded. It's the people and how we affect people. That's my reward.
And that's what ENDO is working to achieve.
I feel in a very meaningful way like I have family here. Family who is helping me do the work I do.